Welcome to our Y.E.S presentation. My name's Amy. I work at the North Suburban YMCA. I have with me Brooke Nani. She's a community educator with the Alzheimer's Association. We're lucky and welcome her to with us today to spend about the next hour or so chatting about new advances in Alzheimer's treatment. Um, if you guys have any questions, you can put them in the chat box and Brooke will have some time to answer at the end. And I thank you on behalf of the NSYMCA. We're happy to have you here and I'll let you take it away, Brooke.
Thank you so much, Amy, and great to be here. I'll give a little bit of background about me. Why am I here talking about this? As Amy mentioned, I'm a community educator volunteer with the Alzheimer's Association for about a year now, leading presentations just like this, catching people up on the latest research, the latest education, and just get a good handle on Alzheimer's and dementia as a wider term. I also worked with the Alzheimer's Association for a couple years on a research study that was focused on preventing brain health. And you might see the data coming out later this year for that. So that might be fun to look forward to. And then for my full-time role, I work as a director of health and well-being at a local nonprofit. But really my passion for the brain health and the cognition side of things happened because my grandfather was diagnosed with a frontal lobe cognitive condition. And seeing that progression and seeing how that impacted my grandma and my family just made me really want to speak to it and educate others and just do what I can, my small part to raise awareness. So it's great to be here and it's great to virtually meet you all. I will take a stab at sharing my screen. So give me a little wave if you see it shortly here. Should be sharing and then I'll make it larger. All right, so the content for today, thank you, Amy, is new advances in Alzheimer's treatments. And it's a really cool time to be able to talk about this because there's really a lot going on and a lot changing in the world of Alzheimer's treatments. So, what are the objectives of the presentation today? We'll start by listing the FDA-approved treatments for Alzheimer's, and there's kind of two types that we'll get into here. We'll talk about the impact of what's called anti-amyloid treatments on the brain, and we'll get into what that means a little later here. We'll talk about the benefits as well as the side effects with those newer treatments, and then we'll explain the pathways to accessing or obtaining treatment, if that applies to you or someone you know. And then finally, I hope you will leave with a good idea of the wonderful resources that the Alzheimer's Association has available for anyone. So we'll jump into things here. Let's start by stepping back. Why is it important that we're talking about treatment? Why is it needed? So more than 6 million Americans right now are living with Alzheimer's disease. They have this diagnosis. And just a reminder, dementia is kind of like the umbrella term, and then Alzheimer's disease is one cause of dementia. So the actual diagnosis is Alzheimer's disease when we're looking at these data. And then that's a huge number, right? But then we look at the amount of unpaid caregivers that are supporting individuals with Alzheimer's or other dementias. That's over 11 million. And what that looks like is, as I mentioned about my grandfather, maybe it's a spouse that's taking care of that individual. Maybe it's a daughter, a relative, a neighbor, or a friend. But cumulatively, this is the number that we're looking at right now. And it's very likely that that number will get bigger just in looking at the trends of data right now. So what we're going to talk about is different than medications that were on the market previously, because these medications actually target the underlying cause of Alzheimer's. So if we can talk about slowing the progression of an Alzheimer's disease diagnosis in the early stages, right, before there's a lot of pathology and buildup happening, then we can think about individuals having more time to actively participate in daily life. We're talking about sustained independence. I can do things by myself a little longer. And then we're talking about memories. I can potentially hold on to my very valuable memories a little longer, even despite having this diagnosis. I will repeat this maybe 8 times today, but each person is fully individual. So when we're talking about these treatments, these drugs, it may look different in one person to the next person, or it may not impact very much in an individual. So certainly not a cure-all situation, but it is great progress that we are making in the right direction. So on the next slide here, we'll just talk about what is on the market right now and what makes those medications that target the underlying course a little different than what we had prior to. So hopefully you're seeing this little timeline here. In 1906, we had the first description of Alzheimer's disease. In between 1996 and 2014, we had the development of treatments for cognitive symptoms of Alzheimer's. So the goal for this was to treat those symptoms. It wasn't really a long-term solution. They are still being prescribed today. And then there's some examples listed here. But what's different lately with Leqembi, which was approved in 2023, and with Kisunla, which was approved in 2024. And just to clarify, if you're looking at all these crazy names here, we have the name of the medication, and then the generic is next to it. So just to clarify that piece. But Leqembi, generic name lecanemab, was approved in 2023. And again, this intends to slow down the actual disease progression by targeting the underlying biology of the disease. And we'll talk about the biology in the next couple slides here. And then Kisunla is the newest one. It is also called donanemab as a generic name. And it was approved in July. It's done by Eli Lilly. And it's actually administered as an intravenous infusion. So it goes right into your vein every 4 weeks. Initially, for the first 3 treatments that you're getting of the Kisunla, it starts with 700 milligrams for the dosage, and then it doubles thereafter. So following treatment is about double at 1,400 milligrams. And our clinical trials have shown us that Kisunla can reduce beta amyloid plaques, which again, I'll show you what that means in a minute, in the brain, which can then slow cognitive decline by about 22% compared with the placebo. So a pretty big number, and it does give hope here. Rather than treating symptoms, now we're targeting the underlying course of the disease. So keep talking about that underlying course of the disease. Let's get a little bit into the pathology here. So I'll start by saying research is targeting a ton of potential causes of Alzheimer's. We're going to talk about the 2 hallmarks of this disease, but just as an example, some other things that might impact or cause Alzheimer's could be inflammation, vascular changes, metabolic changes, and then a buildup of proteins in the brain, which is what we'll talk about here. So this first visual is a glimpse into the brain. And we're talking right now about tau neurofibrillary tangles. And you can kind of visualize it here. These little squiggly lines are exactly what we're talking about. So tau is a protein. It's in everybody's brain, and it helps to keep your neuron or your brain cell healthy. And it allows nutrients and other essential supplies to move throughout cells. Oh, sorry if you can hear my dog sneezing. In some people, but not everyone, those tau proteins become twisted and they cause these tangles that you can visualize here. And when that's happening, now my brain is no longer to get those nutrients, get those essential supplies moving through our brain cells, and then that contributes to the actual eventual death of the cell. And that's just one cell, but this does happen a lot in a brain. Not for everyone, again, just when tangles occur. The other hallmark of the disease, and a very important one because that's what these new treatments are specifically targeting, is called a beta amyloid plaque. And that's another protein that's just naturally produced in the brain. But when someone has Alzheimer's, scientists believe that there's something strange going on with these plaques in the brain. Sometimes the beta amyloid proteins clump together, and I think you can see my mouse, but all these little yellow things that are clumping up around the brain cells are called amyloid plaques. So beta amyloid, normal protein, but then they can start accumulating and grouping up and causing a plaque, which we then believe also could lead to cell death or tissue loss, which can be observed in the brain of someone with Alzheimer's disease. And then ultimately, as you can imagine, when brain cells or neurons, as they're called, are dying, there's going to be an effect generally on a person's ability to function. So those are the two hallmarks of Alzheimer's disease, and beta amyloid plaques are what these newer treatments are working to target. So Leqembi was one of the first treatments that addressed the underlying biology of Alzheimer's disease. Note the parentheses, it's not a cure. Even in the numbers we were talking about earlier, it helped with 22%. That's not 100%. So brand new, we're starting in the right direction, but it's not going to be considered a cure, at least not right now. How they work is by attaching to and then removing the beta amyloid buildup from the brain. So each works differently, and each is going to target the beta amyloid at a different stage of the formation of those plaques, those little chunks of the yellow marks that we saw earlier. But clinical trial participants who received anti-amyloid treatments experienced a reduction in cognitive and functional decline, meaning that these treatments slowed disease progression. Again, different than those earlier treatments, which were just trying to help manage the symptoms. Here we're seeing some tangible differences in our brain pathology. These treatments are appropriate for people who have mild cognitive impairment, which is kind of like people that have mild cognitive impairment don't always graduate to developing dementia, but we're starting to see some cognitive change. So folks that have mild cognitive impairment or MCI, these treatments might be appropriate for, or if someone has a mild dementia stage. So if you're familiar, we go by stages when we're talking about an Alzheimer's diagnosis. And as of yet, these treatments are not known to be effective in those later stages. So it's really key that early stage is where the treatments are being discussed or utilized if the physician and the family and the support network think that's a good plan. And you need to have evidence of the amyloid plaques in the brain. The reason for that is because, as I mentioned earlier, there might be some other causes of Alzheimer's. So we don't want to give a treatment that's going to target an amyloid plaque if, in fact, that's not the reason for these changes that I'm noticing in my life and in my cognition. So again, it's pivotal. These treatments are a really big deal, but we're not at the point yet where we can say we have a cure for Alzheimer's. So these are the first of a number of new treatments that will be to come. Moving on here. So what are some outcomes? So these treatments, again, they change the course of the disease in a meaningful way for some people. Again, everyone's an individual, and effects are not going to be the same across every individual. But people that have mild cognitive impairment or mild dementia due to Alzheimer's might be able to more actively participate in daily life. They do a little nod to activities of daily life, which means those things that we do day in and day out. We get to the bed, we get to the bathroom, we shower, we get ready, and even things like paying bills, getting groceries so we have food to eat, etc. For an individual with mild stages or mild cognitive impairment, this could be huge. It really could be life-changing for folks. But again, another note that individual response to treatments may vary. When considering any treatment or any medication, hopefully you feel confident talking to your physician. They're going to be a good go-to. They're going to stay on top of all the research that's going on, and they intimately know your situation. So they'll be able to apply their knowledge to, is it a good fit for this person, and what are the things to consider with that. Talking about side effects, all drugs have side effects. You probably know that. Maybe you took an antibiotic and noticed your stomach was hurting or something like that. But anti-amyloid treatments too do have side effects. Some of these are serious allergic reactions. Some of these might be amyloid-related imaging abnormalities. So like when we're thinking about brain imaging, the amyloid is harder to depict there, a little bit different because of what this treatment is doing to our brains. Infusion-related reactions, as you see here, headaches might be a concern, falls might be a concern. And then just delving a little bit more into the ARIA, or the amyloid-related imaging abnormalities. It doesn't usually cause symptoms. So you may not even know that this side effect is occurring if you're trying one of these treatments, or if someone that you know is, but it can be very serious, and it can cause additional swelling of the brain or potentially bleeding. So again, talk to a physician before considering these treatments, especially because you don't get to see those noticeable symptoms or know that that's happening. Just to speak to, some people carry a gene, excuse me, called APOE4, and it may cause an increased risk for the ARIA, this condition that we're discussing. So, as a result, the FDA recommends that genetic testing occur to look for that gene to see if maybe I'm at an increased risk for this potentially dangerous side effect, again, before deciding to delve into treatment. And again, that's going to be a conversation you have with your physician. They'll know what to bring up, how to present the information to you so you can weigh the potential pros and cons and really safely make that decision. These are not all the possible side effects. So again, just talk to that doctor, make a treatment plan that feels good for you, feels good for them, and weigh all of those potential benefits and risks. So how is this treatment administered? Well, by IV infusion. We kind of spoke to that a little bit earlier with the Kisunla medication that was from July 2024, but that means that the medication is going directly into my vein, into the bloodstream. The Leqembi happens every 2 weeks, and if you recall, the Kisunla happens every 4 weeks, and the dosage kind of changes as you're progressing through the treatment. An infusion can't be done at home generally, so you're probably going to be headed to a hospital or an infusion therapy center to get that taken care of. Again, every 2 weeks or every 4 weeks for the Kisunla. So that all being said, we understand the medications that are out there. We understand that there are certainly risks, and we kind of see how these new treatments are different than those symptom-focused treatments from before. Now I want to know, who is a potential candidate for treatment? As we've alluded to, those later stages are a little bit more difficult to treat. You might not be considered a good candidate if late stage dementia or Alzheimer's is the current situation. But if anyone has mild cognitive impairment, and again, we can see that that's related to this amyloid plaque buildup, we're going to need to see that evidence. We're going to need some brain imaging to make sure. And while the FDA doesn't directly state what type of diagnostic tests should be used, there are many ways that this could be done. It could be a test that involves your cerebrospinal fluid between the brain and the spine area. They'll analyze that to see what's going on. Or it could be just amyloid PET imaging, positive electrotomography, I think that stands for. But it's part of the process just to see if that amyloid is in there. And again, because of the risks for side effects, especially the ARIA side effect, You may, even in that conversation with your doctor, FDA's got it. Let's make sure that people are genetic testing for that to see if we are at an increased risk for developing this, because a brain bleed or swelling is quite serious. These treatments are not approved right now for other causes of dementia. So I kind of alluded earlier to dementia is our umbrella. Alzheimer's is one of those causes. There are several other causes that are different biologies in our brain. We're going to see different pathology, different issues popping up in the brain. So these treatments don't help with that, or not yet anyway. Right now, it's just focused on the beta amyloid. So how can I access treatment if this is something you or someone you love or know or a neighbor might be interested in? What do I do and how do I access it? Well, as I've said again multiple times, talk to your doctor. First, you're going to want to determine if you are a good candidate for the treatment. Again, what does that mean? That means I have mild cognitive impairment due to Alzheimer's, or I have a mild early stage dementia due to Alzheimer's. And then again, they're going to do that confirmation to make sure that there's plaque that they're going to then target with these treatments. And your doctor will do a preliminary assessment and then refer you to a specialist if they and you feel that that's needed. Okay, so that's if I'm dealing with a diagnosis or know someone who is. What can I do to help with this cause if I do not have a diagnosis? Well, there's a ton of ways. So you can learn about the 10 warning signs of Alzheimer's disease. Once you know what to look out for in you or a loved one or anyone, then you can kind of be aware of, okay, these are some changes that I'm looking out for, and it might mean that I should follow up with my physician and see what's going on and get some testing going on. You'll want to share your concerns. You'll want to then get a diagnosis. And then you may again be referred to a specialist, like potentially a neurologist or a neuropsychiatrist, to then say, what is, a potential treatment for me? Or is this normal? I hear a lot at my full-time job. Okay, Brooke, is this normal aging? Is this what I should expect because I'm in my 80s or 70s? Or is it something to be concerned about? So never hesitate to check with your doctor. They can even do a little mini cognitive test in the office to kind of see if there's any red flags, and then they'll be able to direct you to the right next step. And you might be wondering, how can I learn about the 10 warning signs? Well, that's where Alzheimer's Association comes into play. So you can always visit the website at alz.org. There is a plethora of wonderful information that's available there. There's an online education program that you can take specifically to learn about the 10 warning signs, or you can call. The association has a 24-hour helpline. So I'll give you the number, and I think it'll be on a slide later on as well, and you can email Amy or I later to grab it. But the number is 800-272-3900. And not only will they have someone there 24 hours, but there will also be master's level social workers, social service, public health professionals that can always be available to help in that moment. So again, just a note that early diagnosis is really important, not just because we want to know what's going on, we want to make a care plan and figure out how we can make this work with our existing situation, but also because, again, these treatments are more effective and truly designed for those early stages. So there can be a benefit to taking care of it right away, even if you're, I don't know if it's anything concerning, doesn't hurt to get it checked out. So just a reminder on that. And then just a few slides left here. Let's talk about cost. New medications might be very pricey. It's also intravenous. These are things that we must consider. So how would it be covered if I have my discussion with the doctor and I decide and they decide that this is it, this is a good decision, I'll start this treatment? Well, the good news is that CMS, the Centers for Medicare and Medicaid Services, have said that they will cover Leqembi as long as an individual's physician enrolls them in a CMS approved registry. So what does that mean? Your doctor will do all that part, if that's where things go according to the treatment plan. And again, that means it applies for, maybe I have Medicare, should be covered for that. Maybe I have Medicaid, which is different, should be covered for both because this is a CMS covered treatment. And then there may be additional state requirements. So something to look into, or again, ask the physician directly here in Illinois or wherever we are, how does this look for me? And then something that maybe we don't think about as frequently, Veterans Health Administration. So maybe you or a spouse, family member was involved and are a vet. That might be another way to look at exploring coverage for treatment. And again, it's some, so maybe not everyone would qualify, but certainly an avenue to explore. Other insurance coverage is going to depend on the individual's plan. So let's say maybe we're still working and potentially it's an early onset diagnosis. And my work insurance would need to look at the treatment and then decide, okay, can I cover this or not? And then here's the rationale behind that decision. The Alzheimer's Association, we're working really closely with CMS, other payers, the physician community at large, and then general health systems, as well as community partners like you all at the YMCA, to try to just do a smooth rollout because we believe that this is a really huge change in treatment. And we believe that if there's a way that we can kind of slow the progression and allow folks to sustain independence and do the things that they love independently for longer and keep those memories, it's worth it. So certainly the community is advocating for that. And then just one more little review, and then we'll go to questions here. But ton of resources available through the Alzheimer's Association, and they're all free, which is wonderful. So I talked about that helpline. Here again is the number, and I'll check with my superior, but I think I can share the slides with you all so Amy can provide them to you to check out after the presentation. But here's this helpline. They'll give general information. They can help refer. They have support groups. They've got all the languages you could possibly need. And then you can be transferred to a care consultant, someone that's master's level in the social services realm who could help with more, less like connecting to resources, but more individualized care and planning for you or your loved one or anyone you know. And then the website, again, plethora of resources available, alz.org. They keep it easy on us to remember. But again, languages are not an issue. Most of the information and resources are available in many. There's also free online education programs. So we nodded to the pertinence of thinking of the 10 warning signs of Alzheimer's. You can check that out online if you want. There's an online community where you can talk to others who may be impacted by this disease, whether directly or indirectly. And then something called All's Navigator, which helps create an action plan. So if I'm feeling overwhelmed and I don't know where to go, this might be the best way to get a safe and comfortable plan together. There's also a really cool community resource finder that the association teamed up with AARP to develop, and you can put in little terms and specifically find out, are there resources in my area that I can tap into that might make my life easier? And then finally, just in the community here. So we've got education programs, we've got support groups, there are early stage specific programs, in person and virtual, thank goodness for Zoom, and then resources available in several languages and even for diverse populations, including LGBTQ plus communities. So that is my little spiel here. I will stop share. And then I do see some questions. So Lynn, you were way ahead of us. I see your question is, are those drugs paid for by Medicare? The answer is yes, at least for Leqembi. I will double check for Kisunla and get back to you. That one was approved in July 2024, and I just want to make sure that that's also approved by Medicare. But I know Leqembi is, and again, it's just going to deviate when we're thinking about what if I'm on a private insurance, might that be covered, and what do they consider? And approved registry. Lynn, I don't know the answer to that question. I will try to find out. And then again, so I'll get you answers for Kisunla. Is that also covered by CMS? And then what the heck is an approved registry? But other than that, anything else on anyone's minds? Questions or comments?
I have a quick question. So, you were talking about how different types of Alzheimer's are caused by different things. Today we talked mostly about the ones that were caused by the plaque. Um, the percentage for like how many people are diagnosed based off of the plaque buildup versus other um, things
That
of
is a great question. I will try to get the exact percentage, but I can say that there are a variety of diagnostic methods. So when we're thinking about, like I alluded to, neuropsychiatric testing earlier, that's not an image of your brain. That's
Mhm.
more like a 4-hour process where you're doing some cognitive testing, and the answer of that is just going to say broadly, you have dementia. So if
I
I
see.
want to know specifically, do I have Alzheimer's dementia, or is it Lewy body, or is it
Mhm.
vascular? Any of those other options that might require imaging or a spinal tap. But I think we have the data that suggests which percentage, and I will get that info to you all as well.
And is it normal for people who get a dementia diagnosis for them to then their doctor to advocate for them to do the further testing to figure out which kind, or is that normally how that goes about?
I think it kind of depends. Who is the
Uh-huh.
physician? What is the insurance? Would they cover,
Oh.
say, an MRI or a PET for that? But it is pertinent to think about because when you get that imaging, not
Mhm.
just for treatment, obviously, I need to know if there's amyloid plaque buildup in my brain before I try to diminish that. But even each of the different things that might be occurring in my brain might then present differently. I might have different reactions or symptoms or changes that I'm
Mhm.
noticing. For example, anything that might occur in the frontal lobe might more seriously impact my decision making, my
I see.
filter, how am I operating in a social setting? So it's really important if you can get that detailed image to know what that specific pathology is for treatment, but also how is this going to affect me personally, what's going on
Mhm.
in my brain. But it just kind of depends. Is my doctor recommending that? Is there access to these things that this would be
Mhm.
covered? Will my insurance cover it? So
Mhm.
big questions there. Yeah.
Yeah. Oh, thank you.
Oh, what department of the YMCA is presenting this? I
Oh.
don't know, Amy.
Oh, this is part of the Y.E.S program, which is the YMCA education series, and it's just a completely free program that's open to everybody, specifically for educational purposes. Yeah.
All right. Well, I will do my homework and get you all some answers. Make sure that I can share my slides and then pass those to Amy.
Great.
And then we'll go from there. But it's been such a pleasure spending time with you all. And Amy, thanks so much.
Oh, thank you so much. We really appreciate it, and we will be in touch soon.
Perfect. Everyone have a great day.
Thank you, Brooke. Bye-bye.